I am honored to part of this audience for this conference on Zero Dengue Death Initiative in Sri Lanka, which is conducted as a result of collaborative effort of National Dengue Control Unit and World Health Organization. This workshop has an impressive set of objectives targeting improvements in clinical management of dengue, along with improvements in multidisciplinary engagement, human resources, infrastructure, monitoring and evaluation framework, as well as community engagement. These are priority areas emphasized by the WHO Roadmap for Neglected Tropical Disease 2021 to 2030, which aims to achieve 0% case fatality rate due to the dengue by year 2030. As all of us know, dengue constitutes a rapidly emerging threat in increasingly urbanized world. The global economic burden of the disease was estimated at nearly $9 billion. The incidence of dengue has increased drastically by more than 300% since 2009. The incidence is likely to increase even further with climatic change. Today, 3.9 billion people are at risk in 128 countries, of which more than 100 are endemic for dengue. Considerable percentage of cases of dengue are asymptomatic. Each year, an estimated 400 million people are infected with the virus. 100 million become ill with dengue. Dengue is treated at all levels of health system. However, secondary infection can be severe, and severe dengue is managed at hospitals. Each year, about 21,000 deaths that occur globally can be attributed to dengue. While biological factors as well as social determinants of health are related to these deaths, majority of dengue deaths are avoidable. Dengue is a major public health problem in Sri Lanka and currently endemic in some districts with cyclical outbreaks. Over 100,000 cases were reported in 2017 and 19, and that is an incidence rate of 866% per 100,000 population. Annual Health Bulletin 2020 status that 31,162 cases were reported in the year, which is an incidence of 142 per 100,000 population. Case rate fatality is about 0.1%. There are several districts with the incident rate which is higher than national average. You all of know the Batticaloa, Trinco, Jaffna, Kalmune, Colombo, Ratnapura, Galle and Gampaha. In order to achieve 0% case fatality rate due to dengue by year 2030, modifications are required in terms of screening, confirmation of diagnosis, prognostic systems of triage, epidemiological and entomological surveillance, and sharing best practices and resource to mainstream dengue management, which collectively provide a greater catalytic support. And in order to consolidate dengue control and preventive efforts, professionals including healthcare personnel, clinicians, public health specialists, field officers, as well as policymakers need to work together while collaborating with the environmental sector and engineers to reduce habitats of vector. For each US dollars invested in community activities associated with vector control, one person is protected from dengue for 1 year. However, rising resistance to insecticides among vectors is a risk that requires mitigation. So there lies a need to develop evidence-based effective vector control strategies. Vector surveillance, clinical case detection and laboratory diagnosis should be coordinated. After notification of a significant increase in mosquito population, clinician can be alerted to prepare for cases. A medical care provided by healthcare personnel and improved case management results in declining case fatality rates overall. Moving forward from this, we can consider other strategies explored by the WHO, such as improving quality assurance for point-of-care rapid diagnostic test, developing polymerase chain reaction PCR test for the confirmation of diagnosis, and developing preventive vaccines for all at-risk populations, which may be a vaccine for people with previous dengue infection as confirmed by laboratory testing. They could also be rapid response system, streamlined national referral systems, and regional network for medical staff for case management training and knowledge sharing, much like the platform available here today. During the current era of reduced case fatality rate reported as our 0.06% in Sri Lanka, continue to tackling the dengue deaths is crucial to pave the way towards achieving zero deaths by 2030. I would like to take this moment to acknowledge the moment of generated by the clinician in past, especially I think Dr. Lakumak Fernando is here, Dr. Ananda Vijayavikrama and Dr. Shantini and Dr. Hasita, who were spearheaded this during the good olden days, and this is how all the other clinicians and they was trained the staff. So this is how we came to this our low case fatality rate and a good patient care management system. So I think from here to reduce to 0% is not an easy task. It's a very difficult, but I think we should start the journey right now. I think that climate will help us. So when the rain comes, cases goes up. When the rains, when there's a drought, the cases going down. But that cannot be a help. We cannot control that one. So I wish you all experience productive time here and in this workshop today, and from this intellectual discourse, generative prospective outcomes for tomorrow. Thank you.